As many of you know, because you've worked with us on many different things before, the Center for Rural Health has been around for about 41 years, and we do a lot of different things, and one of them being working with communities, which is where the community health needs assessments fall into. And we're able to offer these at the price that we do because the Medicare Rural Health Flexibility Grant and the State Office of Rural Health Care grants chip in and help pay for the additional costs of conducting them. And this is something that we're very passionate about. I mean, communities finding out what they actually need within their community. What do the people see? Building those relationships with your community members is really important to us. So the goals of the CHNA are to figure out how to address the issues and to improve the health, both physical and mental, within the community. Why do we do these? Well, yes, they are required for all nonprofit hospitals and for public health units that are seeking or are accredited, but they are also, and more importantly, a good thing to do for your community and for the health of your community. It also meets the IRS regulations that all nonprofit hospitals every 3 years and accredited public health units conduct these every 5 years. It shows what the community has, not only as concerns, but also as assets. What are the good points of your community? What can be highlighted when you're recruiting a new provider? What do the community members value the most? It really looks at the community as a whole and how the different components within the community play off of each other. Those social determinants of health, 20% roughly of what determines your health outcomes are related directly to the health care. That means that 80% are from other things, forces within the community. And it's also a way that every 3 years you can kind of look at and see what's changed. Where are things lacking? Where have things improved? Are there new issues that have risen to the top that are now ready to be addressed? So the IRS requirements, this came out as part of the Affordable Care Act in 2011. And it's very vague. It says that you have to address items that are reported on the IRS Form 990 Schedule H. So all components of the Schedule H are in the reports that the Center for Rural Health creates. And it just puts them from that 990 form. The report is readable and it's understandable for the layperson to understand. If you've ever looked at, completed, or read through a 990 form, those are not the most intuitive forms. And so this is just an easier way to see that information. It's required that hospitals work with their local public health unit, but doesn't specify to what extent. So at the Center for Rural Health, we recommend that they're as actively involved as possible, either on the steering committee or as a liaison. But this is not a requirement in the IRS guidelines. At the bare minimum, they must be part of the assessment as a key informant interviewee. In a couple communities, the public health representative is the lead for the whole CHNA process for the hospital. And obviously they work very closely with the hospital while doing this. And it's up to you to determine what the role is. And some public health units share in the cost of conducting the CHNAs, and others, the critical access hospital covers the full cost. Hospitals can also collaborate with other hospitals on their needs assessment. For example, both First Care in Park River and Unity in Grafton are in Walsh County. So those two facilities collaborate on the survey so that there's only one survey that goes out to the residents in that county. And the survey includes a specific question asking which is the respondent's primary facility that they use in case we need to pull specific data out just for one facility or another. There are separate key informant interviews and separate community meetings for each of the communities so that we're going out to them and the community members don't need to travel so far. And for the past 3 cycles, Walsh County Public Health Director has been the lead CHNA liaison, and then the second or third liaisons are from each of those hospitals. So just another way to do it if you're ever wanting to collaborate with another hospital in your area. The CHNA must also assess services for minority and underserved populations. And it needs to include all health agencies in the community. That's human services, social services, public health, IHS if that is available in the area, any clinics not affiliated with the hospital's health system, and so on and so forth. In rural communities, all health providers play a role, which is why I mentioned non-affiliated providers. It's rare, but occasionally there will be a health system and a non-affiliated health provider in the community that don't get along. So be it. That's how it is. We get that all of us that are working on these CHNAs are from rural towns ourselves. And so we understand that sometimes those relationships are very hard to mend. They've been there for years and years and years. And it's not our job to tell you that you have to get along with somebody. However, we do need to ask them some questions at other facility. And I can tell you that I'm not going to preach to you about that because none of you guys have had that issue in the past. And then last but not least, legislation does not specify how to conduct the CHNA. The CRH has conducted assessments since 1980, early 80s. But when we began conducting them after the ACA mandate, we worked with the National Center for Rural Health Works to see how they were doing their assessments, and also met with the North Dakota Department of Health and NDSU to go over the process so that we could make sure that we were providing the best process that we can that encompasses everything and really gets at the needed information in addition to just satisfying the IRS requirements. That's also why we're always looking to improve. So anytime, and I don't ever take offense, if you have criticisms, please send them to us. We want to improve the process. So if there's a different way to do it or something that just how we're saying it doesn't make sense, let us know that. We do these all the time. So what we're saying does make sense to us, and it may have just never occurred to us that using the jargon or however we're saying it doesn't translate well. Let us know. We want to make it as easy as possible for the user. The CRH conducts 33 of the 36 North Dakota CAW CHNAs, and it really helps in getting us consistent data, enables and lets us create aggregate of the whole state. We also look at the reports and pull the information from the 3 facilities that we don't do the assessments for because we want it to encompass everybody. Nobody's required to use the CRH for their needs assessment. So then the next part is implementation strategy. And after those top issues have been selected, this document states how they're going to be addressed. Essentially, it's a work plan for community health improvements. Includes things such as your activities, goals, measures, partners, resources, and when it should be completed. And it covers 3 years, but it can always be modified. Public health accreditation, like we said a little bit, this is voluntary, and we do have a few in North Dakota that are either already accredited or seeking accreditation, and they have to conduct theirs, the accredited public health units, a minimum of every 5 years, where hospital, community, or nonprofit hospitals are every 3 years. Then we'll go into the CRH CHNA website, and it's ndchna.org, easy to get to. And it's really an area that everything that we do with CHNAs is right here. So the orange on this map here, the orange multi-headed icons show or depict CHNAs that was a full partnership with their local public health. And that means somebody from the public health was either a liaison or on the steering committee. And we're updating this map all the time. So if you see anything on there, that isn't correct, shoot me an email and I can definitely update it. The hospital icon ones, the blue H's, show that public health was involved, but they served as a key informant and provided their list of services, not necessarily serving as on the steering committee or as a liaison. Then finally, the public health icons show public health units that have conducted independent CHNAs in the past. So the homepage just gives an overview of what the CHNA is, or what a CHNA is. And then you can go into the different items in the table of contents. This one, which is communities sharing the same need, is data that we collect that we can then share the findings among communities, and hopefully facilities can use this information to find others to collaborate with or to talk to them to see what they were doing for an issue. So ability to retain providers. Maybe Wishick is wondering what Bowman did for that. So they go ahead and give them a call, and a way to get ideas, or if they want to collaborate, you can see who has similar issues that they want to tackle. With the new CHNA implementation activity grant program that the CRH is offering, this is a good place to look for activities to tackle as a network and to apply for funds. And that CHNA implementation activity grant program is the one that I sent out via email, and I'll show you where it is on the website in just a bit. So this one, you click on 2 or 3 towns and you can compare them, or you can click on any one and see what their needs are. So here I clicked on Ashley, Linton, and Wishick, and it shows side by side what each of them have as their top needs. And it also shows the year that their assessment was for. So sorry, I froze. Here we go. Are we working? Okay. So then this page, this has every facility, every critical access hospital, and I guess every hospital in the state, because it has non-critical access hospitals too, listed by the town name, and then all of the documents associated with them. So looking at Devil's Lake here, this is where we list each of the items that we have for them. So first is the hospital profile. And Devil's Lake, or Dickinson is the one I have pulled up here, I guess. You can see we asked, this is a little bit new to the process. Previously, Julie Frankel, who was with the Flex program, who's no longer there, she would send out a request asking to communities or facilities to update these. She wasn't getting a real good response. Some of them were close to 10 years old since they had been updated. And so we decided that this is a great thing to incorporate into your community health needs assessment, to include as an appendice, but also it's information that is available to Stacy Kusler, our workforce specialist, when she's out in communities. If you have somewhere or a position open and she goes somewhere and is around students or providers looking for jobs, she has this available and can use it when she speaks to them and advertises the positions that you have available. So this is now part of step 1 in the CHNA process. We upload this and then you send us any changes that need to be made.
Kylie, I got a question on that
Yes.
because I'd gotten that. I provided all of my updates and sent it back to the email address that it came in on, and it keeps getting kicked back to me.
Oh.
So is there another place that I can upload that to?
Are you hitting was it an email from the toolkit and you're hitting reply?
I think it may be.
Okay, you can't reply to anything that comes, any email that comes from the toolkit, you can't directly reply to. You have to go into the toolkit and upload it there, and we'll go through how to do that. Hey, Amy.
Okay, thank you.
Yes. Amy, while we continue, will you upload something to the test as a test community? Anything?
Sounds good.
Thanks. Okay. So thank you for doing that. Yeah, some sites have already sent us their corrections or their updates. Then the next item is a new item, and this is the brief economic impact report. And it's a one-pager, and we did this for all 36 critical access hospital communities last December. And we worked with the Center for Rural Health out of Oklahoma to figure out the FTE or how many employees and financially what the impact is in your community. And this is a great tool for giving to legislators to show just how important healthcare is in the community. And we did this year in December, the North Dakota Rural Health Association gave for any legislator that serves your area, we gave them the economic impact one-pager for your facility or your community. Then some communities had a economic impact report, a full one, and these are large, like 60-page reports that were conducted between 2010 and 2019. And if there is one, it's uploaded on this site. If you're interested in something, a full economic impact report, again, please let us know. The person, well, this one you can see was done by the Center for Rural Health many years ago. Since then, we had hired an outside facility to do those, a university, and they no longer exist. Well, the university exists, that program no longer exists. So, but if there's interest, we'll definitely look and try to find, we'll work with other states and see who they use for things like this. Then your community health needs assessment report is linked to here. And we link this directly from your website to our page. And the same with your implementation plan, linked from your website to ours. And then something new we started doing last year, well, I guess now it's 2 years ago because it's now 2021, is just the brief snapshot is what we call it. I can think here. It's just a snapshot of what the findings are in your community health needs assessment. Okay, then this is a page that's meant for ideas to help you if you're looking for ways to implement activities, things you can do to implement the findings of your needs assessment. And we're always looking for ways to update this. And we are hopefully this summer going to be putting a bunch of additional resources onto this page. Okay, community spotlight, please submit yours. We really want to add to this page. We know you've done a ton of interesting implementation activities, and we'd love to share them. You don't have to, if you can just shoot us an email, any of us, an email. We have a communications person within the Center for Rural Health that can reach out to you and collect more information from you. It won't be, it's very brief. It's not asking you for any deep diving details. We just want to share those ideas and give other people ways to maybe stimulate idea generation. I also want to mention that at the Dakota Conference in Rural Public Health, which is the first Wednesday, Thursday, Friday, June 3rd, 4th, and 5th of, well, June, there's a buzz session and a presentation on implementation. And I definitely encourage you, if you're not already going to the Dakota Conference, to go. It is virtual this year because we know you guys are extremely busy. And so this way you can tune in when you're available, just have it up on your computer and come and go as you please, no travel required. The North Dakota Rural Health Association is also offering scholarships. We still have quite a few left available. The deadline to register for those scholarships is March 14th. So I think that's next week. Yeah. End of this week. It's pretty soon. So please, if you are interested in attending any of the Dakota Conference and want to apply for a scholarship, please do. That's on the Dakota Conference website on the Center for Rural Health webpage. Okay, resources and funding to address community health needs. Here are some places that may have funding available for strategies that you are initiating. And one that we have open right now through the Center for Rural Health is this third item, Community Health Needs Assessment Implementation Plan Funding Program. It's a very brief online form to complete to apply. And the key with this one is that all the funds, you can apply for, public health facilities can apply for up to $2,500, critical access hospitals can apply for up to $5,000, and rural health clinics can apply for up to $2,500. It has to be spent by June 22nd of this year. So if you have anything that you could use a little extra funding for, please, by all means, submit. We have funds that we need to use because we had activities that we had planned pre-COVID, and COVID just hasn't allowed us. So we have these dollars and we want to get them out into your communities and help you guys to improve the healthcare there. So if you have something, you aren't sure if it's a good idea or not, you can shoot an email to me. Let me know. I can let you know if it's something we would fund or not.
When's the deadline for that?
That I want to say that is
the 18th. It's the 18th.
Yes,
March 18th.
March 18th. Okay.
Yes, and we have funding still available for that. We haven't had that many submit yet. And we will in future years, we're going to keep doing this. But for this year, we have a bunch of extra dollars that we need to get out to you guys, because we can carry them over, but we don't want to do that. We always want to get the money out into the communities if we can. So then on to the CHNA process. So this is a sample timeline for a community that's deadline is the 31st to have board approval, which will be all of you guys, because CHI wants them available to them by January 1st. Since your fiscal year end isn't until June 30th, though, your implementation plan isn't due to the IRS until December 15th of the following year. So the timeline is about a 7-month process, June through December, and then the implementation plan is due 5 months and 15 days after your fiscal year ends. It's very important to stick to the timeline as much as possible or be ahead of it when doing these, because we have lots of them and we don't want you to feel rushed, and we don't want any balls to get dropped. And just, it makes it a lot smoother if you're able to just keep with the timeline, check the items off of the checklist, and just keep moving through step by step. And if there's any questions at any time along the way, put in as an activity into the toolkit your question. It's just like sending an email. And that way, by you putting it in the toolkit, it goes to all of the CRH staff. So we're always going to have more than one person assigned to your community. And this way, we're all on the same page. Any of us can answer it. Instead of if it goes to somebody's email and they broke their leg and they're out for surgery for the day or for the week, we don't want you to have to wait for a reply. This way somebody else can get back to you right away. Looking at the timeline here, the survey is generally open for about 3 weeks, and then we allow an extra week for the paper or mailed in surveys to come through the mail. The survey can also be extended for about a week if the response rate isn't what you were hoping to get in the time frame, just so that you have time to give that one final big push. We do recommend doing a big push before the deadline, but that doesn't always happen. Then after we close the survey and wait a week from the original close date, if it wasn't extended, it takes 2 weeks for our CRH researchers to get us the graphics and the survey results. So while the survey is open, we want to be conducting the first community meeting and key informant interviews, and encourage those people to encourage others to also complete the survey. Okay, so how do we stick to the timeline and get everything done in an organized manner? The e-toolkit is our key to do this. For those that went through their last cycles, and you guys, so many of you said so many nice things, we really do appreciate it. We love working with you on these, and we want to give you the best product and make it as easy on you guys as possible. You have a million hats out in your communities, and this is just one more thing for you. So anything we can do to make it easier, we try to do. Make sure that the correct people have access to the e-toolkit. If there's someone that should be taken off, let us know. Or if there's someone else that needs access, get us their contact info and we'll get them added. That's no problem at all. We do ask that at least 2 people have access to the toolkit per community, and so that if someone's gone or if something happens, there's still someone familiar with the process that has access. And we can, at any point in time, add or remove people. Okay, so we'll go through the toolkit, and I'll get out of, stop sharing this. And we'll go into the actual toolkit. So this is the CRH website, and over here on the right-hand side, e-toolkit portal. And I'm going to go in as a community person. And everybody has their own login, individual login. Okay, so now I am a CHNA liaison, and the name of my town is Test Community. And you see my name up here. This is what step 1 looks like. And we'll just go through and look at each item. So if you click on activities up here in the tab, you can see Amy just added that here's the agenda for the day. I'm going to do a new share. going to share my whole screen. So over here, you can see when Amy put this, here's the agenda for today, into the toolkit, I got an email in my email box that says UND CRH toolkit. I can't reply to this, but all that I need to do is click on it and it'll take me to the toolkit. And if you aren't already, I'm already logged in, so it went right to this page. But if you aren't already logged in, you'll just have to log in and then it'll take you to this page. So if you want to, don't hit reply on the email itself. Go in and add as an activity your response. So here's the agenda. I'm going to add an activity and tell Amy, thank you. And then just go down. If I had anything to upload, I could add it here, but I don't. I'm just telling her thanks. So I click submit. And then once I do that, she will now get an email that shows that something has been uploaded in the toolkit. And that's to make sure that you aren't having to check your check the toolkit all the time. You'll know because you'll get that email if something is put in there. The next tab at the top here is files. And here are all the templates and sample documents for you. So my sheet will not move over. I'm going to do the community. In step 7, you're asked to fill out your community assets and overview template. So I'm going to click on that to open it. Click on, it'll open, let me share this. So here it is. I'll make my edits. Anything highlighted here, you need to look at and change to fit your community. So this is about the community in general, and then the hospital, and then the public health here, and then some more information that's specific to your community. Again, anything highlighted, you complete. So I see, okay, I save that, and now I want to add it as an activity. So I'll go add activity, and this is step 7. I'll browse for it, and community assets. This is the one that I just saved and updated. So I add it there, and I just put in here. Type and click submit. And it's taking forever. Okay, it really does go. I'm completely frozen. Oh, there we go. There it went.
While that's uploading, Kylie, another quick question for you.
Yes.
Looking at the timeline, step 1 is actually listed in there with the completion date. Is there completion dates for the other steps?
That's generally the date that's listed on the right hand side, or yeah, on the right hand side. So
You see, it doesn't have the other steps listed on the timeline. It only has step 1.
Oh, it doesn't have the name of it. Okay, these are
Right.
each. Sorry, I will go through. I have never noticed that before. I'll go through and update that. So that's step 1. This is step 2. Draft survey is step 3. I think. I don't know. We will update this and get the revision uploaded this afternoon with the actual step numbers in it.
Okay, thank you. Yeah, I tried to do a side by side and they didn't match up. So
yeah, okay, yeah,
confused me.
wonderful. Thank you. Thank you. Exactly why I love holding things like this, so that I see things that I don't see. Great. So.
Hey, Kylie, this is Julie in Oaks.
Yes.
Since we're talking about timelines, we have gotten some communication from our mission leader, Andy Santos, that now that we're not CHI anymore, we're Common Spirit Health, we don't appear to need to have this to Common Spirit Health till March 31st of 2022.
March 31st. Okay. Okay. Yeah, they have not told us that. So thank you for that information.
Sure.
May I
Julie,
Yeah.
this is Marianne. Are you sure you understand that correctly? I interpreted that to mean they want everything done and wrapped up by March 31st. So you'd still have to, in order to get there, you'd still have to do this timeline. But maybe I misunderstood.
Well, what Michael is saying is don't worry about December 31st.
Okay. Well,
we will have a meeting next week, I believe, to discuss this a bit more.
Okay, well, if that isn't the case, will you let me know? We're gonna still try and stick to this timeline because we have others starting too, and this will help to ensure that everybody gets completed on time. But yeah, if you actually don't have to have it to them until March 21st, we'd love to know.
And I would keep that very high level at this point, because there's an opportunity that we're not going to be Common Spirit by the time this completes.
Yeah.
Yes. Okay, so at this point in time, we're continuing with this timeline of assuming December 31st is the end. Okay, so that was files. Contact us lists some of the CRH staff here. And then under the communities, it has at least one, sometimes more, contact for each of your communities. So if there's somebody that you are looking to get a hold of, check here. And then frequently asked questions. It's exactly what they are. They're questions that we get asked quite a bit. So we've put them right here. This was something we added, I think, 2 years ago. And if you have any questions, this is a place to start, but these are also on every activity that you go to. When you go to step 1, down at the bottom, if step 1 had, I thought that they had, oh, never mind. I'm used to my point of view shows. So yes, frequently asked questions. If you want to see those, you need to go here. I'm going to go back to the PowerPoint. Share that. So step 1, this is the information, or a lot of the information that we need for IRB or Internal Review Board approval. And each step has the to-do list. As an activity last week, I uploaded a revised to-do list that includes the COVID process, if we're still doing that at the time, which as of right now, we are doing the COVID process. So these step 1 things are things that you can do right now if you want, but they do need to be done. That's that March deadline that showed on there. That's when we want to for sure have this stuff as an activity. And I will upload a new timeline later today. So do you need a letter of support from both the Critical Access Hospital and Public Health? So a letter of support from Public Health is not a requirement of the IRB. However, if they're going to be a true collaborative partner, we really want to have one included in there. And we highly encourage this. So we'll also need, in addition to their letter of support, we'll also need their logo. And then no matter how involved they are, if they're a collaborative partner or not, we always need public health services because we ask specific questions of those during our interviews. So every step has a resources in the top right corner. And here you can see the CAW letter of support template, public health letter of support template. And then please use these templates for your list of services. You might have a nice fancy flyer with them. We really need them in this format. We use them for the interviews and also for the report. And like I said, over here in the right-hand corner are the resources. For the logos, you can upload those in whatever format you want, a JPEG, a PDF, GIF, whatever you have available. And then on the services template at the bottom, it'll say the year that the template was created. You can leave it or delete it, completely up to you. And then that is really all for step one. Here you can see what the template for the hospital looks like. And be sure you go through this and check and make sure these are the actual services that you have. Change these to match what you guys have. And also at the top here, general and acute services, if you don't want to call them that, you can change that heading. Screening and therapy services, change the heading if you want. That is completely fine. And then services provided by public health. You might have 10 listed, you might have 40 listed. Whatever services you want to have on here, please list. And if something is new, if you could put a star by it or just let us know somehow, that would be great. Because a lot of times we'll hear them say, oh, I didn't know they offered this. We can then do a little advertising for you too and let them know that this is a new service that is offered. And so that'll just help us. And if during the process, if you discontinue some service, let us know that too, so we can update it. Then step two, also with the services, like I said, make sure that they're current. We've had some that we're going through the interviews and people are like, I'm pretty sure they stopped doing this 5 years ago. And so then we go back and then we ask somebody at the hospital and they're like, oh yeah, we haven't done that in a long time. It just got missed, which is fine, just as a reminder to check on those things. So step two is developing your steering committee. And this shouldn't consist of all just hospital employees. You want to diversify it. So you want your liaisons to also be members of your steering committee. If you don't have a public health person serving as a liaison, which we know isn't always a possibility, especially this year with COVID and the extra tasks that are being put on them right now too, it's not always a possibility. So try to get them on your steering committee. And if they can't be on your steering committee, then at least a key informant interview. It's a requirement to have both a hospital employee and a public health professional on your, or it's not that, I can't talk. So it's not a requirement to have anybody in particular on your steering committee. This is your steering committee. You say who's on it. We recommend somebody from the hospital, somebody from public health, and then maybe you want to have school board member or a business owner. And a lot of times there's more than one person from public health and or the hospital on it. Just make sure that you keep the steering committee a workable size. We recommend 4 to 6 steering committee members. So in addition to the liaison, a lot of times the CEO or CFO is also on it. there should be an additional 2 to 4 members invited. And it's just, if it gets too big, it's hard to juggle all the multiple schedules during the process. Regarding uploads on this, if you have like a letter that you sent them and you want to upload it, you can. That one isn't required, but it's nice. The toolkit is a repository. Anything you put in there is going to be available for you next time too. So whoever does the process in your community next time doesn't need to recreate the wheel. They can go back, look and see what was used, the language of it, copy and paste it into a new email this year. It's really us trying to make it easier for everybody going forward. And then the steering committee member template, we do need you to fill that out once you have those steering committees developed and upload that. Okay, step 3. Steps 1, 2, and 3 really can be going kind of simultaneously, because as soon as you get that steering committee, they should be looking at the survey, or you can have the survey ready for them to give the final review for, because in the items you upload in step 1 and the survey all go to the internal review board for us to get essentially permission to survey your community or do research in your community. And we have to have that approval from them prior to being able to release your survey or conduct any of the key informant interviews or focus groups. So you can look, let's see, the base survey is on here. If you look under your resources in the toolkit, the CHNA survey tool is the first 5 pages are your basic questions. Those are required for all of them. Then there are several examples of other questions that you may want to add. You don't have to add any. You could add 5 different questions. Just make sure that you keep your survey at a decent size. You don't want, people aren't going to want to complete a really long survey. So on the paper ones, we say you don't really want it more than 6 pages front back, or 6 pages total, sorry, 3 pages front back. And on occasion they go longer than that. And oftentimes they're just over 5 pages, but that's kind of a rough idea. You can add, like I said, you can add other questions, and they don't have to be ones that are listed as sample questions too. We'll pull up the survey. Okay, here is survey development. Okay, can you guys see the survey here? Okay, great. So here you can see pages 1 through 5 are the mandatory questions. We'll fill in the stuff at the top here, your logos, based on what you've already uploaded in step 1. Don't worry about this stuff. So these are the base questions. And then once you get down here, sample elective questions. If you want, say you want this one. Well, of course. Okay, you want to have this question. So I'm going to highlight it in green, and you want to have public health services one. Highlight this in green. Make sure you go through any questions and make sure that the services are actually offered. So our facility doesn't offer correction health or TB testing. There, and here we have an additional MAT services. We would write that out. I would use the acronym. So then I could save this, upload it as an activity, and just in the text of the activity right here under the description, I would just say the highlighted green questions are the ones that we want to add to the survey. You can do it that way, or you can copy and paste the question right into here that you want added. However you want to get the information to us is just fine with us. And then we go through and put it in the location within the survey that it should fall into. For survey numbers, oh, something else with the questions. In addition to not wanting them to make the survey too long, also make sure that you ask questions that you want to know the answer for. If you ask a community, would you be willing to pay a 1.5% mill levy or tax increase that would be put towards a new infusion center, and they come back and 98% say no, and you go ahead and raise the taxes anyway, it's not really showing responsiveness to your community. So if you aren't willing to reflect on what they say, then please take that into consideration when deciding whether to add a question or not. What is your goal number of surveys that you want to get back? We shoot, if we don't hear from you, we put 15% of your community that's over the age of 18, or that's 18 or over. But you can say a specific number. Our goal is 220 surveys, or our goal is 20% of the population over 18, over 17, because we can't survey 17 and under. We can only do 18 and over. If you want to survey students or children, youth, let us know. There is a way we can do it. It just requires another IRB process, but we can do that. So let us know. We haven't always done this, but we are asking that you start with 50 paper copies, and you can always get more. We switched to this because what we do is we print copies of your survey, and then we package them along with a return envelope into another envelope, and then send those to you for you guys to disseminate. And people used to start with 250, 500 or more surveys, and they take a lot of time to put together, and we were not getting very good over the years. And every year it gets more and more internet based. People aren't filling out the paper copies and sending them in. Right now we have a community that was very insistent that they start with 250 copies. So we did it. Their survey, today's the last day that it's open, and this is after the survey's been extended, and we still have not gotten a single paper copy in. The original deadline date on the paper copy says March 1st. So I'm guessing that out of those 250 surveys, paper surveys that they had to disseminate, we won't get any paper ones back. There are, and that's just been the trend, and especially now with COVID, people aren't necessarily going out and going places where they would typically pick up a paper copy. People are getting very used to doing things online. That said, there's definitely some people that will only fill it out via the paper copy. So we want to have those available. And there's some communities, Devil's Lake, for example, has a huge service area, lots of counties. Makes complete sense to start with more than 50. So if you feel that you want to start with more than 50, let us know. While your survey is open, someone from the Center for Rural Health will post in the e-toolkit at least weekly, if not more frequently, to update you on your response rate. And if it's ever you want to know on a certain day and it hasn't been updated for a couple days, let us know and we can pull it up and let you know how many have been received to date on whatever date it is. If receiving a 13% response rate is considered average for this type of survey. So if you're getting a 20+%, that's really, really good. It shows that your community is very engaged with taking the survey. We used to automatically include a QR code on the top of the survey and as a way to access the online survey. We aren't automatically doing that anymore. If you want it, ask. It's very easy for us to include. Another thing to think about is if you want to have an incentive for submitting the survey, such as being entered into a drawing. So this is really easy to do with the online ones, because if they fill it out and click submit, it can go to another page that has a separate link or a separate page that fills in their contact information to be entered into the drawing. So we'd never know who submitted what survey. If they're paper, you may want to have a drop-off place for the surveys, or for the, if you put a piece of paper in there for them to write their name and their contact information on to sign up for the drawing, have a drop-off place for that. Some ideas. Not very many communities do an incentive, but some do, and so wanted to let you guys know. Typically, surveys are kept open for 2 to 4 weeks. And then if you want to, you can extend it. Like I said earlier, that's completely up to you guys. And we work with you as it gets closer to the end date to say, hey, do you want to extend it or not? That's why we asked for that goal. So we kind of know where we're sitting on if we're going to want to extend it or not. So step 4 is plan the first community meeting. And this is pre-COVID. CRH staff travel to your community and we hold a community focus group meeting and also do the key informant interviews when we're out there. If the COVID modifications are still in place, what we do instead of going out to your community and doing the community meeting is we do additional key informant interviews to replace that first community meeting. So instead of doing 5 or 6 key informant interviews, we'll do a minimum of 11. That's the absolute minimum. We like more of the 13 to 15. And that's at level 1. If you're level 2, we like to do a lot more than that. Let's see. And right now, we are in the COVID areas or COVID process still. And as it gets a little closer, if you want to continue having us not come out for that first community meeting and just doing extra key informant interviews in place of that, we can do that for this year. So let us know your preference. Okay, but now we're going to pretend that isn't the case. If we are coming out to your community, you'll need to look at your calendars and let us know dates that your site visit cannot occur on so that we can try and get that date set. We want to get your community meeting date set as early as possible. Be sure to keep in mind any basketball games, church night, one-act play. all those different things that are going on in your community that would pull participants away from the meeting. The meeting is generally 1 to 2 hours long. And then when we do the key informant interviews, those are generally, excuse me, 45 minutes. Let's see. So because the CRH have to arrange travel and coordinate other trips too while we're there, we try to get the communities that are geographically located together to hold their meetings at the same week to accommodate travel. So if we're going out to Garrison, if we could do Turtle Lake within a day or two of that, that would be great, so that we aren't driving almost back out to the same place the next day or 2 days later, or a week later, however long it may be. And for this too, another reason we like to set them up early or get dates on the calendar early is so that we can work with you to see what would work best. If it works best for you to have key informant interviews from noon until 6 on Tuesday, and then have your community meeting they want a breakfast meeting at 8 a.m. on the next morning, we can do that. And then if there's a few more key informant interviews that you want to do after that, we can do that. We don't like to, traditionally, we don't like to spend really more than one night, overnight at a community. On rare occasions, it happens. And generally those are due to weather. Julie and I were stuck in Botno for I don't know how many days one year. So
3 days.
3 days, 3 days. Julie remembers very well. There wasn't much open either. So let us know if that works better for you. Otherwise, a lot of times we'll come the night before, and we'll go from 8 a.m. until 4:30 in the afternoon or 4 in the afternoon, doing key informant interviews. And then at 6 o'clock, we'll hold the community meeting, and then we'll travel home that night, unless we're way out west, takes several hours. So if we're way out west, then we might have to spend another night. But that's kind of a typical schedule. We also ask that if we are doing key informants all day, that you leave us time for a little lunch break. I get hangry, and I know some of the other gals doing these do too. And so if you give us 45 minutes to eat, that would be wonderful. There is this first community meeting planning template that has the information that we need to know from you. So once we have, for the date, working on it, just treat the toolkit like email, and we can go back and forth and figure out a date. And then once we have that date set, then you can fill out the first community meeting template and send that in. That has the location and number of key informants, what time it's at, things like that. Key informant, at the start of the community meeting, we ask that the CEO or someone, it can be a liaison, a CFO, board chair, whoever, give a brief welcome and discuss a few things that have been implemented based on the last CHNA, so that participants can make the connection of what they're telling us does matter. For key informants, we like to do these in person when we're out in the community. On occasion, if there's no way for us to interview that person that day, then we'll do them over phone or Zoom. And we recommend having 5 to 7 key informant interviews. You want to pick a location that's can comfortably hold everyone. And also for the first meeting, we don't have a PowerPoint, but we do have to have them write or circle things. So you'll want to have a table and chairs for them. And it can be wherever you want, at the health system, a restaurant, senior center. Just with COVID, keep in mind any social distancing restrictions that your communities might have in place. And then we highly encourage serving food, no matter what time you hold it, if it's in the evening for supper, noon for lunch, or early morning for breakfast. Food really helps to bring people in. And you want to plan your meeting to give people time to grab their food and sit down before we get started. For the community meeting, we recommend having 10 to 15 people attend. We like to have at least 10. More is fine. It doesn't always happen, and we completely understand that. You can't physically force somebody to come. We do recommend for both the community meetings and the key informant interviews that the day before we're out there, that you shoot them an email or give them a call and remind them of it. And that way, that also gives them a little extra, hey, we haven't forgot about you either, and we do want you there. We value what you have to say. We ask that you complete the key informant RSVP template, the second to the bottom one, and submit that a minimum of 7 days. That just helps us with our planning within the CRH so that we know what time those key informant interviews are. And then after the community meeting, please submit an updated community meeting demographics spreadsheet that lists everyone that was in attendance, and add it, if anybody additional showed up, add them to it. And then you're also responsible for uploading the sign-in sheet. The sign-in sheet is just exactly what it says. When they come to the meeting, we ask that they sign in. That way we know who was there, and we don't identify them in the report, as we never say any names, and we don't say what business they work for, but we will say there was representatives from the faith community, from the school or education system, the law enforcement, different groups like that. So we need to know who actually was there so we can see where they represent. Okay, so step 5, we're getting there. This is your survey has been approved, and IRB has gotten back to us and said you're good to go. So we have mailed you the hard copies of the surveys, and we've uploaded a link. And if you want the QR code, we put those in the e-toolkit for you, so you can go ahead and begin advertising and really do that media campaign to get the word out. The more surveys, the better. We really want to know what the community has to say. So you'll want to brainstorm, and this is a survey, or a steering committee is great for this. If you have marketing people or somebody that just has an interest in marketing, they're great people to bring into this. Figure out where and how you're going to spread the word and get the surveys taken. We've had lots of great ideas over the years with hard copies. Some have, and this hasn't been done in a few years that I know of anyway. The actual hard copy of the survey was put in at the grocery store. They would put them in a bag for each customer. What has been done a lot and has seemed to work well is making a flyer and putting the URL on there and the QR code and having that stuffed in grocery bags. Kids take them home to their parents at school, so the teacher hands them out, sends them home in the kids' folder. Church bulletins, putting it in there. There's lots of great ways to do this. Social media is a huge way of disseminating it now. So some ideas are to, so we create a custom survey link for you. Here's an example of the one for Valley City, and then also their QR code. And you don't need to execute each and every one of these resources in your promotional campaign. Figure out what will work for your community, and we recommend using multiple different ways. These are just some examples that I'm going to show you. So here's a flyer that Crosby put out. Hung these up at the gas station, set them out at when people would pick up the program at the high school basketball game. This was sitting there too that they could grab. Stick in grocery bags. Facebook here, putting the survey on there, doing radio ads, putting in the paper press releases, letting them know that the community's voice does matter. Here's a letter that went out to residents in the community. And then they also had little business cards made with the link and where they could pick up surveys. Here's another Facebook post, just advertising it. So like we said, we generally start out with 50 paper copies. If you want less or you want more, talk to us. And the survey distribution plan document is a working document. So upload it at the beginning with what you plan, and then upload it again later with what you actually did, because a lot of times that changes. So it's time for your first community meeting, assuming that we aren't doing COVID anymore. If we're in the COVID precautions and we're just doing the key informant interviews, then this one you won't have to do anything with. So the CHNA liaison is responsible for printing off the sign-in sheet and making sure that everyone in attendance has signed in, including the liaison. And things that you can do to customize your meeting is, you know your community best. If people don't know each other and you think they should have name tags, let us know. We can bring name tags. If you want to do an icebreaker, let us know that. We can do that at the beginning. Just, we are very willing to work with you and do what makes the people in your community the most comfortable. And like I said before, do a follow-up and remind people of the meeting. Then on to step 7, and ideally we'll have the date set for the second community meeting prior to the first meeting, so that at that first community meeting we can announce the date and invite everybody at that first community meeting, and anyone that was invited there but didn't show up, invite them, and also all the key informant interviewees to attend the second community meeting. One thing I forgot to specify is your key informants and the people at your first community meeting. You don't need to invite the key informants to that first community meeting. There'll be key informants and then come to the second community meeting. If they're a key informant and they come to the first community meeting, it's really just duplicative for them. The key informants are asked pretty much the same questions, just in a way that we're able to pull out a little bit more detail. So we really want those to be separate people. At the second community meeting, we want everybody that we've interviewed or through the community meeting or key informants to be at this. And also anybody that wasn't able to make it, but you think that they have good input or would have good input for the community. A lot of times there's some top people from the hospital, that's weird to say. There's some administration from the hospital public health units at these meetings. or especially at the second one, even if they weren't at the first, and you can invite those. That's your call. For the second meeting, you'll need to have a screen and a projector, or have a screen, and we will bring the projector and laptop unless you already have one there. Just let us know and we'll use whatever you have available. You'll also need to have a room where everyone is able to see the screen. Ideally, it'll be an actual screen or a white wall. We've had on occasion where we've made do, and we can do that if we need to also. And make sure that there's enough seating for everybody. So step 7, and these items in step 7 that I'm about to talk about, you can start doing now if you want. They really can be done early. You need to complete and upload the community assets and overview template and the projects and programs implemented to address needs identified template. So this is showing where to upload it, how to upload it. For the community assets and overview template, that's the one that we looked at right at the beginning, where it talks about your community, about the hospital, about the public health unit. The projects and programs implemented to address needs identified template is what did you execute based on the findings from the last CHNA? Please do not just copy and paste your last implementation plan in here, because that's what you were planning to do and what you were planning to have. We want to know the actual outcomes, what was actually done and outcomes from those activities. So that goes in here and gets uploaded. Then we also want 8 to 10 photos to include in your report. And we start working on your reports right away when we start the CHNA process, so that the information is fresh in our heads when we're writing the report. So if you want to fill these templates out now or early, go for it. One less thing for you to have to do later. And most of the stuff in the community assets and overview template is probably very similar to what you had in there last cycle. So if you want to pull up your one from the previous cycle and just make any updates and re-upload it, you are certainly welcome to do that. And if we are still under the COVID modifications rule, you don't have to do any of the planning for the second community meeting. You'll just need to let us know if there are additional people that you want to, that you would have invited to that second meeting. Because what we'll do in place of the second community meeting is we record what would have been our presentation that's on site, and then where we would typically go around and give you guys sticky dots and have you go to different pages that we hang up on the walls with the different top community needs that were found in the CHNA process. Instead of doing that, we put that into a Qualtrics survey. And so we email out the presentation link so that they can watch it. And then we ask them to complete the Qualtrics survey and select their top 4 needs or issues that they feel are the highest needs of the community. And this doesn't take long. It's, I think, 3 questions. It just asks them, it might only be 2 questions. Ask them to select their top 4. They don't have to rank them, just select their top 4 out of the top needs. And there's around, I don't know, probably 35-ish, roughly 30 different needs that are the top findings from the process. And then it also asks them if they think anything should be combined. So say that depression for youth was found as a top need and depression for adults is found as a top need. They can say, and I give an example in it too, they can say combine the depressions for depression of all ages, things like that, so that they can give us, and then there's another, I guess it's 3 questions because there's another one that says, anything else you want to tell us? To try to gather it as best as possible with us not actually being there. And again, that's if the COVID precautions are in place, or if for this year, if you know for a fact that you want to do it that way because you don't feel that the community will be comfortable having gathering in the community meeting, just let us know. We want to do what will work best for you guys. So at this second community meeting, we show the results from the survey, key informants, and first community meeting and secondary data that we found. And we also recommend providing food at this meeting, and it'll be about an hour long. And then after this, or like I said, at the end, they go through and they rank. After this, we go home and we should have your community assets overview template, photos, and programs implemented by the time this community meeting is held, so that we can really hammer out the last parts of your report so we can get it to you.
Kylie?
Yes.
Sorry, this is Julie. I just wanted to, there's a question in the chat box that I feel that I know the answer to, and I was just going to answer it, but I figured I'd bring it to your attention, being you're the one who kind of runs the show. Is the second meeting happening face-to-face for sure, whether or not the first meeting was not done due to COVID? Or is it possible the second meeting will be held virtually as well?
It is definitely possible to hold that virtual. If UND is still required to be following the COVID protocols, then we'll have to do it virtual. If not, then it's up to you guys. If we hold the first one in person, then our office will be allowed to definitely come out and do the second one in person. But if that first one is held virtual and the restrictions have been lifted by the time the second one comes around and you want to hold the second one virtual, you still can. Or then we can come out and do it in person too. Thanks, Julie.
Absolutely.
Okay. Step 9 is closing the CHNA process. We are winding down, you guys. We will get out early, I think. So as soon as we get back from doing your second community meeting, or after we've got the survey results in from that second meeting, if it has to be done virtually, then we will finish writing your report. Once we're done with it, there's 2 of us at least. There'll be, for every community, there will be at least 2 CRH staff assigned to your community. Some will have 3. And so one person writes it, the other proofreads it, and then it goes to our communications manager within the Center for Rural Health, and she proofreads it. Then after her, it goes to our graphics person, and she puts it in the final format. Then once we get that back from her, we proof it again, and we also upload it for you to proof. We ask that you go through it, let us know any things that you see that don't look right. We can't change data. I mean, if there's data that got carried over, like when the graphics person was putting the new stuff in and she accidentally left a paragraph from a previous report and we don't catch that and you see it, because a lot of times as soon as we get that back from her, we'll upload it so that you can look at it too, just to try to save time, keep it moving so that you can get it faster. But if you see something like that, that obviously will take out and change. But if there's something in there and you just don't like what it says, that can't be changed. At the end, there is a spot where people can type in others, or if they have essay type answers, those are all included in appendices or in the appendices. And if they don't, we go through and we look through them and we make sure that there are no names included in those, or if they're saying, oh, I love Dr. So-and-so, he's been great. Something like that we would leave. But if it is something negative and a specific person's name is mentioned, we will take out that person's name. And but we're leaving in that there's an issue with something, whether it be in administration or a provider or something like that, so that you know, and you can, if you want to address it, you can, but specific names will not be mentioned. Once we get the edits back from you, we work with our graphics person again, and she makes the edits within that document, and then we upload a final version. If you see anything in that final version that needs to be edited or that we missed, again, let us know and we'll get it changed and get you the final version. That is the big part of it. The big part of the CHNA process is then done. What's left is for you to get board approval. And once board approval is received, shoot us a message in the toolkit or upload an activity in the toolkit and let us know that it's been approved by the board, and also post it on your website. You need to have the most recent 2 community health needs assessments posted, reports posted on your website. And then once we see that on your website, then we'll link that to our website. And then you also need to have a hard copy of the report available for people to access if they come into your building and request it. Be sure to thank everyone in the community for their help and share your findings. If people submit information, they're curious about what was found out. So let them know that their input matters and show that it's being used. And then you'll also have to create the implementation plan. And again, this is due 5 months and 15 days after the end of your fiscal year. And the Center for Rural Health is very open to helping you with this, whether it be coming out and helping you do a strategic planning session or brainstorming activities that can be ways to address the needs. Just contact us. We're happy to help you in any way that you need us. And also, we might have ideas for funding opportunities if you're looking for some. And like I said, we will be providing going forward for at least, I wrote it in the State Office of Rural Health grant for the next 5 years, funding related to CHNA project implementation. And the Flex program is also going to be putting some funds into that. And those can be network activities too. So behavioral health, mental health, treatment, huge issue in darn near every county in North Dakota. And if you want to work with 4 hospitals in the southeast region of the state, say, and have a behavioral health provider that does telemedicine out to all 4 of your facilities 4 days a week, and then 1 day a month she's in person in your facility. Just an idea. And you want to get together to have a planning meeting with each of those with all 4 facilities together and make a plan and see if this is something that's feasible. That's something that you can submit for funding for through the CHNA implementation grant activity fund that pay for travel if you need a room, things like that. So if you have an idea, let us know or submit a funding application. And I believe that is all. Before I forget, in the CHNA toolkit, I did upload a link to complete the survey for the training evaluation today. If you would do that, because everything that we do has to be evaluated. Any questions? Okay. Well, thank you all so much for joining. I know it was a lot of talking, and believe it or not, I'm not a fan of talking unless I'm sitting in a social scene. But I thank you for your time, and we are here for questions. Julie and myself have been doing this for a number of years. Amy's been doing it for a few years now. And then Nicole has been doing it from your guys' side. So she has a great point of view that we're loving, that we can hear things from her that way. And so she'll be helping with those. And we are also currently hiring 2 more people to come on, and one will be a full-time, and the second one will either be full-time or temporary. We don't know yet. We're hoping full-time. But so we'll have lots of fresh faces on this process too. So it's really important to use the e-toolkit instead of just emails to talk to everybody. That way it can be a learning process for us, for all the new people too, and also for those of us that have been on it, because every year we learn something new. Again, any process improvement ideas you have, let us know. Otherwise, we'll let you go, and thank you so much. And we're excited to get working with you on these.